Ear infections, also known as otitis media, are very common in children. They happen when the middle ear, the space behind the eardrum, gets inflamed and filled with fluid. This can be painful and uncomfortable for your child. Most ear infections are caused by bacteria, particularly Streptococcus pneumonia and Haemophilus influenzae. These bacteria can easily travel to the middle ear, especially in young children who have shorter and more horizontal eustachian tubes. The eustachian tube is a small passageway that connects the middle ear to the back of the throat. Its job is to drain fluid and regulate air pressure in the middle ear. However, in children, the eustachian tubes are narrower and more prone to blockage, making it easier for bacteria to get trapped and cause infection. Viruses, like those that cause the common cold, can also lead to ear infections. When a child has a cold, the virus can inflame the eustachian tube, making it difficult for fluid to drain and increasing the risk of a bacterial infection. Recognizing the signs of an ear infection early is important for prompt treatment. Young children may not be able to verbally express their discomfort, so it's crucial to pay attention to their behavior. One of the most common signs of an ear infection is ear pain, often indicated by the child tugging or pulling at their ear. Infants may become unusually fussy or irritable, cry more than usual, and have trouble sleeping. Fever is another common symptom of an ear infection. The fever may be low-grade or high depending on the severity of the infection. Other symptoms include fluid draining from the ear, which may be clear, yellow, or bloody. In addition to ear-related symptoms, children with ear infections may also experience symptoms of an upper respiratory infection, such as a runny nose, nasal congestion, cough, and sore throat. These symptoms often precede the onset of ear pain. If you suspect your child has an ear infection, it's crucial to take them to the doctor for proper diagnosis and treatment. The doctor will use an instrument called an otoscope to examine your child's ears. An otoscope is a handheld device with a light and a magnifying lens that allows the doctor to see inside the ear canal and examine the eardrum. By looking at the eardrum, the doctor can determine if there is fluid behind it, if the eardrum is red or bulging, and if there are any signs of infection. The treatment for ear infections depends on the child's age and the severity of the infection. For young children under 6 months of age, antibiotics are usually recommended to clear the infection and prevent potential complications. For older children with mild symptoms, a watchful waiting approach may be appropriate. This involves monitoring the child's symptoms closely and providing pain relief measures, such as over-the-counter pain relievers, while the body's immune system fights off the infection. However, if the symptoms worsen or do not improve within 48 to 72 hours, antibiotics may be necessary. While not all ear infections are preventable, there are steps parents can take to reduce their child's risk of developing them. One of the most effective ways to prevent ear infections is to ensure your child is up to date on their vaccinations. Vaccinations against pneumococcal bacteria, PCV13 and PPSV23, and Haemophilus influenzae type B, Hib, have significantly reduced the incidence of ear infections in children. These vaccines help protect against the most common bacteria that cause ear infections. Another important preventive measure is to practice good hygiene. Teach your children to wash their hands frequently, especially before eating and after using the bathroom. This can help prevent the spread of germs that can lead to colds and ear infections. Avoid exposing your child to secondhand smoke, as it can irritate the eustachian tubes and increase the risk of ear infections. If you smoke, consider quitting or smoking outdoors to protect your child's health. Antibiotic resistance is a growing concern, and it's crucial to use antibiotics responsibly to prevent it. This means only using antibiotics when they are truly necessary and completing the full course of antibiotics as prescribed by your doctor, even if your child starts feeling better before finishing all the medication. You can read more about the subject in the book Common Childhood Infections. We wish you and your children a healthy life.